Hi, this is Dr. PJ. Thank you for watching my channel. So we're going to talk a little bit about how to protect yourself and your family when you're in an indoor situation, whether it's your house or a restaurant or some other indoor place where there's not a lot of good airflow and people are stuck together in close proximity. So a lot of these recommendations come from the CDC guidelines, and of course you should wear your mask, you should socially distance even if you're indoors, and you should wash your hands frequently. Those are the three main things you need to do. But in addition to that, there's some other things you should know about, like ventilation. The airflow indoors recirculates any kind of viral particles or aerosols that you breathe out and other people might be breathing in. So that's why you have to wear your masks, because that decreases that. But if you're indoors, try to set up air circulation so you open the windows. And sometimes you can use a fan so that the fan set up in one place can kind of blow the air one direction from, say, an open window, fan in front of it, blow the air through, out another window. That way you get directional airflow and you get the air moving and you refresh the air inside your indoor living space so that any kind of viral particles and aerosols are flushed out of the house. A lot of people also have air conditioning units, and these air conditioning units in their apartment or their home usually have a filter that you can put into the ceiling or on the wall. And these are called HVAC filters, HVAC. They're picked up at any of the home hardware stores like Lowe's or Home Depot, things like that. And those are typically different qualities. So look for the filter that is HEPA rated and can filter out the small particles down to a few microns, because that'll help filter your air. It's the same thing that they use in the airlines to filter their air, and it's the same thing that the water mold remediation companies use when they bring a HEPA filter into your house to try to scrub the air. That will also help scrub some of the larger particles out of the air that's inside your house. And once again, you can buy that at many home improvement stores. Another thing that you should be thinking about is when you're using utensils and common things. So if you're, say for instance, having a serving spoon in the mashed potatoes and you have family members, you got to be really careful, because if those people have contaminated hands and they grab a serving utensil and then they put it down, the next person who comes will get whatever was on the first person's hands transferred to the serving utensil onto their hands, and then they touch their face and they eat, and that's a source of contamination as well. So you have to just be aware that sharing serving utensils and common utensils and water pitchers that you grab the handle of, things like that, can cross-contaminate people in your house. Some of the other recommendations that are presented by the CDC for people who are infected in your house and have to isolate, of course, is that they stay in their own rooms. They, of course, wear their masks. You use your own bathrooms. You use your own toiletries. You use your own towels so that you don't cross-contaminate. And you should ventilate the rooms where someone is staying to try to get that airflow going to kind of flush the air out that's stale and bring in the new air. And when you need to isolate inside your house from someone who is infectious, you have to make sure that you're in your own room, wearing your masks, ventilating your room. Don't use the same utensils, cups, toiletries, bathrooms, and anything that you touch should not be shared with somebody else. And one last thing I want to mention is how long someone is infectious. So if somebody catches COVID-19 and they have symptoms, then you're supposed to wait, based on CDC guidelines, at least 10 days after the symptoms or 3 days after the last fever, whichever period is longer. So if you're infected and on day 9 you have a fever still, you have to wait until day 12, 3 days after that. If you're asymptomatic and infected, then you have to be isolated for about 10 days after your test if you're asymptomatic. If you're actually really sick and you get put in the hospital with severe COVID-19, then they push out that infectious period to 20 days. So keep these time frames in mind. 10 days or 10 days plus the last time you had a fever, or 20 days if you're really sick. That's something that's important for everybody to know, and that's how long you're infectious. I hope you think about these things and use them as strategies to keep yourself and your family safe, especially during the holidays when I know people will probably gather, but I want you to have your best chance at mitigating and lowering the risk of getting infected and sick. So until next time, everyone out there, stay healthy and safe.